Well, good morning, everyone. TGIF. Thanks for joining us on a Friday, representing your team. This is Michelle Gutierrez, who I think all of you know, and Renee Goldtooth, the Associate Director, is listening in. And we also have, we're very grateful to have Nathania Tsotsi from UNM Center for Native American Health, who will be presenting today and who I'll introduce in a bit. But first, just a little bit of housekeeping. The participant lines have been muted, and you can ask any questions in the chat box, which is in that console there. We'll make sure that we allow a little bit of time to answer questions at the very end of the presentation. And I'll also be sending a copy of the recording, the slides, and all of the tools to all of you and to your teams as well. And as your team representative, we ask that you be the point person in sharing the information and what you've learned. So in terms of framing the action plan, and as we mentioned in several emails and our last gathering and our individual check-in calls, all of the teams will be sharing their draft action plans at the September gathering in Flagstaff. So when I say draft, this is not a first draft. It really should be near the finalizing stages. We don't expect it to be a finalized version yet because we're imagining that once you've presented your action plan to the teams, there may be some questions or things that you hadn't considered and that you want to revise or update. So basically, this action plan shouldn't be something that you whipped up on September 5th, the day before, but instead it should be a result of that thoughtful process of analyzing the data that you've collected from your community over the past year. We don't have a specific template that we're requiring everyone to use, so you have flexibility in creating something that makes the most sense to you. But if you have any questions after the webinar or as you're working through the action planning process this month, please, of course, feel free to reach out to us. So all of that said, we are very pleased to partner with UNM and the Center for Native American Health to help provide an overview of the action planning process and tools that may be helpful to you in creating your action plan. I'd like to introduce our great friend and partner, Nathania Tsotsi, who most of you met at the gathering we had at Buffalo Thunder most recently. Nathania is a lecturer too in the Department of Family and Community Medicine at the University of New Mexico School of Medicine, and she's also the Associate Director of the Center for Native American Health at the UNM Health Sciences Center. Nathania is a member of the Navajo Nation from Burnt Corn, Arizona, and she received a Master of Community and Regional Planning degree from the UNM School of Architecture and Planning in 2011. So please be patient with me as I transfer the controls over to Nathania. Great. It looks like we're ready to go.
Okay, great. Thank you very much, Michelle. Good afternoon, everybody. Again, my name is Nathania Tsotsi. I'm a member of the Navajo Nation. So as Michelle mentioned, I'm a member of the team here at the Center for Native American Health. And I've actually been, I'm a planner by training and have been working in public health research and education now for over 10 years. And so a lot of this presentation this afternoon is going to be based on some of the key learnings that I've had and some of the tips that have really helped me along the process of program development. So before I begin my presentation, I want to acknowledge the fantastic team at the Native Strong program, including Olivia, Renee, Michelle, and the rest of their team. I also want to acknowledge my own team here at the Center for Native American Health and the staff at the Family and Community Medicine Department for their help in putting this presentation together and also in making sure that I could be here for you today. So the goal of this presentation is, again, to help you prepare for the second phase of your Water First grant, where you're going to be building on the findings of your community assessment to make decisions, set priorities, and implement policy and systems change strategies to reduce or eliminate sugar-sweetened beverage consumption in your community. And to help you do that, I'm going to be sharing with you a general orientation to action planning, and also providing you with some tools and examples that I've used in the past and that have worked very well for me in my work with tribal communities. So before we jump into the nuts and bolts of this presentation, I think it's really important to clarify some of the terms that we hear when it comes to planning. Specifically, how is action planning different from all of the other planning terms you've heard? Strategic planning, comprehensive planning, and so forth, for example. So I want to, well, let me see. Can everybody see my screen? It looks like I've had technology issues here. Okay, so now you should be able to see my slideshow again. So action planning is really related to a broader organizational tool called strategic planning. And the typical strategic planning approach will focus heavily on this top part of the triangle that we see here in the image, the vision and mission of your organization. So these are the values that really drive your entire organization or your entire program. If you're in the CHR program, for example, or your school or your clinic. So we expect that these values, the vision and mission, will fan out and eventually influence the day-to-day operations of your program, including your goals, objectives, and activities. And so you can think about this in the context of your own organization's programs, mission, and vision. But I like to think of this in a different way, and I think I like to think of this, for me conceptually, this works out when you think of it kind of using a bullseye or a circular image, where the vision and mission are at the heart of your organization, while all your organization's various initiatives, grants, programs, and activities fan out from the center. And so in this image that you should see here, you can see that I've created a separate triangle specifically for the Water First grant. And so you can think of all of your different grants and programs as a separate petal or a separate triangle on its own. And I like this image because it also shows that there's possibility for not only relationships between your different initiatives, but also opportunities for healthy overlap. And I think the overlap is really important and helpful to us as program planners and in implementing, because it helps us to accomplish multiple goals at the same time. And I want to encourage you to think about the ways that your Water First grant might also complement or correlate with other grants. Like, for example, I think some of your communities have the Good Health and Wellness grant. Maybe there's places where your goals, your objectives, or your activities could overlap so that you can align your resources to accomplish your overall vision and mission. So with this in mind, thinking about action planning is really focusing on the bottom part of this triangle, focusing on the goals, the objectives, and the activities of your specific program. And so an action plan helps us to answer questions like the basics: where are we at, where do we want to be, and how are we going to get there? But we also get an opportunity through action planning to think about how are we going to know when we've achieved that goal, and how will we know when we've been successful? So really a way for monitoring and evaluating our progress as we move along. So why should you develop an action plan? Well, you know, an action plan is kind of intuitive, and well, actually it is highly intuitive. You think about a goal and you think about all the things you want to do to accomplish that goal. And many times that action plan is already in our heads. We've done it before, but it's also important to write it down and putting it into a format that is not only visible to other members of your team, but can also be communicated to your broader audience. And thinking about people who have an interest in your program. Obviously, the individuals at NOTPIC A3 have an interest in what it is that you're planning to do with the grant money that you've received. Your tribal communities may have an interest, meaning the members of your community or even your tribal council. And so developing an action plan is one way of communicating that process to a wider audience. And more specifically, it helps us to avoid overlooking any of the details. It also helps us to understand what might be possible. And in the long run, it helps us to save time, energy, and resources because we have something on paper that actually has a strategic process for how we're going to do things. It also increases the chances that people are actually going to do what needs to be done. So allowing people to talk about what it is that they want to do in relation to your overall goal and putting it down on paper helps to lend credibility to not only that individual but also to your organization and your program as a whole. So I'm going to share with you some really broad, generic action planning steps. And this is not to say this is the only way to do this. This is just kind of the general approach to action planning. So this process that I'm presenting to you here is not meant to be prescriptive for you. By all means, use a process that you know works in your community and you know that you're comfortable with. But overall, a general action planning process really involves 4 major areas. One, it's creating a team of people to work together, to think about, you know, what are we going to do together, how are we going to do all this work, and who's going to be responsible. Pulling that team together is really essential to this process. So planning is not meant to be something that is done by 1 or 2 people locked away in an office somewhere and then dictating what other people should do. It's actually meant to be a collaborative, open, flexible discussion. And so in my experience, I find that that kind of process, this flexibility and open process, really is a lot more effective in the long run. It helps people build skills. It also helps people feel like they're a part of your process. And in the end, it helps them to really feel like they've accomplished something together with you. And that kind of feeling is much more valuable in the long run because it helps us to really generate that creativity within your community to make things happen. And so the next part of this process is that I believe, and a lot of planners believe, that any kind of planning process really should be grounded in facts, in data. And you've already collected a lot of that information in the first phase of your grant by conducting your community assessment. And in just a moment, I'll go over how you can move from that data into identifying some priority areas. But the other broad area that I'm going to focus on today with this presentation is this idea of clarifying goals, objectives, and activities. And many of you I know are very skilled in activities. You've done events before. You know what it takes, what you need, and what it takes to do things in your community. And so I'm not going to focus so much on what kind of activities, but I'm going to focus on how those activities should feed into objectives and goals. When you first applied for this grant, one of the requirements was that you were going to implement 2 or 3 strategies. And in the context of this presentation, I'm using strategies and objectives interchangeably. So another part of your action planning process should be some kind of discussion. And this is really the planning part of it. You'd think it would be the activities, but it's actually this part. This is the planning piece of your process, which is that discussion, that kind of sitting back and reflecting and thinking about, okay, where are we at? What are our strengths? What are the things that might get in our way to us achieving this goal? What are our resources that we have in place? And how can we successfully implement our ideas in the context of these different values? And so this is really where the planning takes place. And this is why it's important to have that team to help you think through these ideas. And so the action planning process really concludes with developing a work plan that identifies your activities and puts it into some kind of timeline. This is where you get down to the brass tacks of identifying individual people or teams or programs to be responsible for an activity, and then what their deadlines might be. And this is, again, where it helps to have people at the table because they can tell you what's a realistic deadline for themselves. Nobody likes to be told to get this done by this time. And it's much easier and much more humble and effective to ask people, this is what we have in mind, how do you want to do this, and what works best for you? Finally, we get to this action planning process of monitoring, evaluating, and updating your action plan as you move along. So an action plan is a little bit different from a strategic plan in that it should be a living, breathing document. An action plan should really be updated regularly, if at least monthly, if not every 2 weeks, kind of depending on how you're moving along. And so it's not meant to be put in stone. It's meant to be something that can be as a tool to communicate your progress over time. And so I'm going to highlight 4 major areas with this specific presentation, like I mentioned before. And I'm going to start by talking a little bit about the community assessment, how to move from that into your planning stages. And then I'm going to focus on how you can clarify your goals. When you applied for the grant, there were 2 kind of general goals that all programs should accomplish or strive to accomplish. One, of course, is the reduction or elimination of sugar-sweetened beverage consumption among youth in your community. And the second was a choice, and that was either to support the increased access to water or increasing breastfeeding supports. And I really like the way that this model was explained to me, which is that you know, we want to reduce something, take something away, which would be the sugar-sweetened beverage, but we also want to give people an option of what to add instead of this. So what are we giving, and then what are we taking away from the communities? And so in this case, it would be water or breastfeeding. And so we're going to talk a little bit about how you can turn these broad goals into specific goals for your individual programs. And then we're also going to talk broadly about objectives or strategies. And objectives are those broad sets of process steps to help make the goals and how to meet those goals and how the team plans to achieve them. And so part of your charge as a team is to identify 2 or 3 strategies or objectives that you're going to implement over the next 18 months of your grant up to March 2019. And finally, we're going to talk about a couple of tools that you can use to develop your work plan. Many of you have a lot of experience doing this, so I'm not going to dwell on this too much, but I'm going to share a couple of alternatives that may be for you to consider with your team as well. So before I begin talking about goals, objectives, and activities, I really want to take a step back for just a moment and talk about what it is this grant really hopes to accomplish. And we know that the Water First Learning Community Grant is really focused on this idea of policy and systems change. In the public health literature, it's known as policy, systems, and environmental change, or PSE change. What does that mean exactly? And how does that influence our decisions as individual grantees? And so what does this mean? Well, the basic definition is that policy, systems, and environmental change is a way of modifying your environment to make healthy choices, practical and available to every single community member. And so PSE is a new way of thinking about how to effectively improve health in your community. And so for many years, health programs have really been focused on individual behavior change. So focusing on a patient or focusing on one person, assuming that if you teach that person what's going to make them healthy, they're going to find a way to do it. And so that puts all the responsibility just on that one individual. So unfortunately, over the years, we've learned that being healthy is not just about the individual choices that we make or the genetics. Today, we know that it's not enough to just know how to be healthy. You actually need to have practical, readily available options around you to help make those choices for you. And that's where policy, systems, and environmental change comes in. So you've also heard those studies about, where you live affects how you live. There's that big study that came out a couple of years ago about zip codes being an indicator of life expectancy. Well, that taught us that you simply cannot make healthy decisions if the options aren't available to you. And so the Water First grant, I appreciate that that grant is really focused on making that level of change. So in order to kind of help you discern the difference between a previous model and the new kind of PSE model, there's a table here that I'm going to share with you. I won't go into this in too much detail, but I want to mention that Michelle sent out an article. It's a quick 2-page article where this table came from to show you the difference. And so I want to highlight an example of a PSE change within a community. So let's say, for example, in a community, one of the ways that, common ways that we have addressed physical activity might be to host a community bike ride and a parade, or say, Just Move It. You know, you've heard of those activities. Well, another way of helping to make those changes more apparent, the PSE change, is to actually implement a policy to make sure that roads are constructed for safe biking, walking, and driving. So that's kind of an alternative or a supplement to what one event might do. And so some of the things you might notice about these two is that this happens maybe one day every couple of months, and then maybe afterward you can't really tell if people really continue to ride bikes. In this case, this policy is in place even after, long after this, long after that particular administration ends, and it continues to offer those opportunities for safe biking, walking, and driving. So that's an example. Another example would be from the hospital setting. So let's say that one program or one event would be focused on free breastfeeding courses for new moms. Well, a PSE change to help supplement that might be to implement the World Health Organization's 10 steps to successful breastfeeding, and then to become a baby-friendly hospital. And so these are changes you'll notice that are sustainable beyond the life of any grant. So even after your Water First grant ends, these changes will still be in place. And so that's what we mean by policy systems and environmental change. And these are the types of strategies you should be thinking about implementing with your grant funding. So I want to shift for just a moment here before we get into the actual changes we want to implement. I want to talk about your community assessment and how you can move from the data to actual decisions and priorities. And so when you first started this first phase of your Water First grant, you were asked to conduct a community assessment to answer several questions. And those questions were to think about how your community views the consumption of sugar-sweetened beverages, identifying strengths and assets, and then also thinking about, okay, who's going to be your partner in this work? What are some policy or systems changes that are needed? And so this is what data that you should have right now available to you. So we're going to talk just a moment about how you can move from numbers, stories, the data from this to actually talking about planning. And so on this slide, I'm sharing with you a tool. And so there's a number of ways to think about moving from data to planning priorities. I think, and what's worked best for me in tribal communities, is just to get a group of people together and talk about it. And so this list is actually a discussion guide for you. So if you want to print this out, blow it up, or if you want me to mail it to you, I'm happy to do that. But this is basically a very specific process of guiding a discussion, facilitating a discussion using an order of questions. And so one of the ways that you can start to move from data to priorities is to assemble a group of people to talk about your results, share the results in that group first, and then have a conversation. You begin by asking people just to read through the data, get familiar with it, underline words or phrases or graphs or images, tables that get their attention, and then ask them to share with you what did they underline, what did they circle. And this is not meant to be exhaustive. There's no like scientific method with this. It's just to get a first sense of the data. And so next, you can talk about, you know, what questions do you have for the team who collected this data? And then asking these questions in the process. And the whole goal is to get to these two questions at the bottom, is to get help and feedback from that team to ask about what is the data telling us about the community, and what should be our priorities moving forward as we begin to plan. And so this is the community engagement piece of your grant. So when we start to identify what the priorities might be, the next step is to really go back and clarify your goals. When you first applied for the grant, it was clear that you were to come up with a program or a policy systems environmental change to reduce the consumption of sugar-sweetened beverages among youth 0 to 8 by either increasing access to clean drinking water or increasing breastfeeding supports in your tribal workplace or within the community at large. So one of the things that you want to do before you even start to action plan is really revisit these goals and take your data that you've already collected, the priorities that you've been that you identified in the previous step, and refine these goals. So each of you should have a different set of goals to present in September as a result of this conversation. And so one of the ways of doing that is to write a SMART goal, clarifying your general goal and moving it into a SMART goal. So a goal summarizes what's expected to be achieved in the long run. And if you're familiar with the SMART format, you know that a SMART goal is specific, it's measurable, meaning there's some kind of way of identifying the process. It's attainable, which means it's realistic for your team. It's relevant, and it's time-based. So let's say, for example, that you've done your community survey, you've done your assessment, you've talked to several people, and you kind of start to hear that the incidence of maybe oral health, dental health, and caries, for example, is a really big concern in your community. And maybe for kids, it's really important because there's kids drinking Gatorade from their bottles instead of water or milk, or they're drinking sodas instead of water or milk. And so what we did is we put together a SMART goal to focus on oral and dental health. And this is an example of a systems change, and it's an example of a SMART goal. And so what we did is we looked at the general goal. We know that's what it is we're trying to do, and specifically what we want to do in this particular example is that by March 2019, that's the end of this grant, we want to collaborate with local parents, WIC, primary care, pediatricians, and dentists. And that collaboration with all these parties is actually the systems change, because it's at multiple levels. It's at parent level, systems level, provider level. And to create a culturally centered, family-friendly educational campaign. And this is that specific part of the SMART, to support achieving early dental health and the elimination of sugar-sweetened beverages. And so this is that relevance that we talked about. This is where it connects back to the findings of your community assessment. And then more specifically, consumption among children 0 to 8. And so I'm going to use this as an example for writing your related objectives and your activities. So how do we move from that into thinking about an objective? Okay. Well, one way to think about objectives is as a group of process steps to meet that goal. And in your handout that was emailed to you, one of the things that they recommend is using a format of short-term objective, middle-term objective, and long-term objective. So to kind of group your tasks into related objectives. So let's take that previous SMART goal that we created about creating an educational campaign. So 3 objectives that might be a possibility related to this are listed here. And so your first objective might be to increase coordination of local efforts around dental health and sugar-sweetened beverage consumption. And so that's that systems approach we talked about, the coordination. And then establishing a coalition of partners before January 1st. And so that gives you a short-term goal. So between now and the end of this year, that we want to have something in place. We want to have this coalition of partners together. In the next phase, or your middle term objective might be, well, you know, we want to create this educational campaign. We have a coalition of people to work with. The next thing we want to do together is we want to promote a culturally centered message about the importance of early dental health. So we want to talk about what is that message we're trying to send out in our community. And we also want to provide educational materials. So we want to have posters and postcards and so forth. And then we also want to have parent and child provider education. So a longer term goal might then be, okay, we have this message, what do we want to do with it? Well, a longer term goal might be to collaborate with your tribal council and local restaurants and convenience stores to provide point of purchase information to promote that beverage options, those healthy beverage options, or maybe this message. And so if you think about this, this would be things like maybe there's a sticker next to the milk options that shows a cultural message that you developed here, and that's provided in all of the stores. Or maybe there is a poster that's posted at the cashier's desk or something along those lines. So this is kind of a longer term process. So once we actually create the culturally centered message, what are we going to do with it? And how are we going to make that sustainable change to the environment and the system as a whole? Well, in this case, we're going to do it by focusing on places we buy and get food, milk, beverage, water, and soda, and so forth. And so this is an example of taking a SMART goal into 3 different objectives. And so this is really key to what's going to happen next, which is your work plan. So many times, those of us who are experienced with this type of work, with doing work in our communities, we jump immediately to the work plan, and sometimes we have to backtrack to think about, oh, what is all this work going to do for us? How is this going to get organized? So the work plan is much more specific than the goals and the objectives because it focuses on those nitty-gritty nuts and bolts details of your program. What is your time frame? What are you going to do in each month or every season? And this work plan is really the tool for helping you to monitor and evaluate your progress as you move along. And so let's take that first objective, for example, that first objective of creating a coalition of partners. So what are some of the activities that we might do to create that coalition? Well, specifically, let's say I am going to identify at least 10 people between now and October who I'm going to invite to serve on this coalition. And those people will be representatives from organizations. They might be parents and grandparents. They might be pediatricians, primary care physicians, and others. And how I'm going to do that, I might just know because I've lived in this community for a long time, or I might ask other people to give me some names. I might ask tribal council to give me recommendations, but if I do, then I should add it as a second activity, whatever that process might look like. The next activity might be, I want to, by November 17th, I want to have a 1-day or half-day orientation for these people. And what we're going to do is we're going to review the grant. That's the first step. I just want to tell people what it is that we're going to do together. And then we're going to do that planning part that I was mentioning earlier, some kind of analysis to think about what it is that we're doing. So 2 common ways of doing that kind of analysis is to do a SWOT analysis. SWOT is a common business tool. It stands for strengths, weaknesses, opportunities, and threats. An alternative to that, and in kind of an appreciative inquiry approach, is a method called SOAR. And SOAR stands for strengths, opportunities, assets, or resources. And the acronym could be different depending on your organization, but it's basically a different way of thinking about where are we well situated to do this kind of work. And so it just kind of depends on which one you choose. Really depends on where you feel most comfortable. Sometimes we like the idea of knowing what our weaknesses and our threats are so we can be prepared for them. But maybe you know what those are because you're doing this work for so long. Let's really focus on our assets and our resources and where we're doing really well. And so in this half-day meeting, you might also, as a result of this conversation, get help from your coalition to update your action plan that you originally started with, the action plan that you'll be presenting in September. Another activity might be then, okay, so after this half-day orientation, what we're going to do, our first line of business is going to be to create a list of elders and cultural leaders to interview about those cultural values of water, breastfeeding, and children's oral health and wellness. Because remember, our overall goal is to develop this culturally centered, family-friendly campaign. And so we need to have information to help us develop that second piece. So I'm not going to go into each objective in this level of detail. I think you get the idea of what a work plan looks like and the differences between them. Instead, what I'm going to do is I'm going to shift over to the different ways that you can do work planning. There's already one way of presenting it, which I'm showing you here, which is just to do bullet points, do an outline, and just write it, might be one sheet of paper. Well, there's other ways that you can do this as a group. The nice thing about this format is that you can print it, you can give it to council, you can give it to your directors, you can give it to community, and everything is there. But when you're working as a team, sometimes it's hard to get input on these specific pieces, and sometimes it doesn't really give you that level of engagement you want. And you know, we always do this thing where one person writes it up and then sends it out, asks for comment, and nobody comments, right? Well, there's other ways that you can actually gain more collaboration and more hands-on experience with this. And so I'm going to present to you a couple of examples. One example is one that we've used quite a bit here at the Center for Native American Health, which is to present a poster and put a timeline on it, and then for groups of people to work together and write down tasks or activities on Post-it notes. And so the way this works is really simple, pretty straightforward. You just put down a time frame. What is your timeline for this? So you might do this by months. You might do this by seasons. You might do this by quarters, however you're comfortable in your community. And these breaks need to make sense for your community. So for example, if you know that everything stops after Thanksgiving and everybody takes time off for the whole winter, then by all means stop your calendar at that date and then start up when you know people are going to come back. So there's flexibility here, and the goal is to not get bogged down in the time frames. Don't let that limit your creativity or your thinking. And so the nice thing about this type of process is that the Post-its can be moved around. They don't have to stay exactly where you put them the first time. Let's say something happens, maybe somebody gets sick, then you move this to the next block. There's nice flexibility in that. You can also get really creative with this. You can use different colored Post-its for each of your partners. Say your CHR, you're working with the clinic, maybe you use pink Post-its for the hospital or something. And then you can remove and add to it as your plan changes. So another way of doing Post-it planning is to organize your columns by row. Who's going to do what? You can say this is the hospital column, this is all the stuff you're going to do, or you can organize it by objective. Say this is objective 1, 2, and 3, this is all the stuff that needs to happen. And then as you move along and you do things, you just move it down to the bottom. And so it's also another tool for helping you monitor and show your progress as you move along. Then you can get, you know, you can use dry erase markers on all of wet erase markers and circle things and do all kinds of fun stuff. I use this method quite a bit in my own work. Finally, another way, the most kind of standard way of presenting this is just to create a table. And I sent out a template with the notes along, well, actually Michelle would have sent it out. And this template really follows what I've presented here in this presentation. I'm not presenting this to you as this is the way you have to do it. This is just an example. You can use it if you want. You don't have to. If you want to do Post-its instead, perfectly fine. But I want to show you what the general pieces of your action plan might look like. So you should definitely start with some kind of background. Talk about your community assessment and talk about how your assessment findings influenced your action plan. Put your goals and objectives here so it's really clear up at the top, and then put in your work plan. So it follows the same format: objectives, all the activities you're going to do, when it's going to be done, and since this is your kind of semi sort of rough draft, if you don't know the exact date, don't worry about it. Put in months. Say this is going to be done by November, or this will be done before Christmas break, so forth. Who's going to do it? Doesn't have to be like, oh, Nathania's going to do this and Michelle's going to do this. It could be like UNM's going to do this and MV3 might do this. And then you might want to put another column for team or the collaborators that you're going to work with, because these activities don't happen on their own and they don't happen just because of one person. It usually happens because there's lots of people who are involved, and it's nice to include those possibilities as well. Once you start rolling through, you can actually use this format, change it up a little bit, and actually use this to monitor your progress. So you can change this column, for example, to progress, and that way you can update it over time. Put it on like Google Docs or Dropbox or something, and then people can kind of see it. So ways that you can monitor your progress would be like percentages. Say, oh, this activity is 5% done. This activity is not done at all because we haven't started. So you can use percentages. You can do status, like say this is still on our to-do list, or we're actively doing this one and this one's done already. You can also use red light, yellow lights, and green lights. It's kind of a nice visual just to kind of look at it really quickly. I really like this format, which is to do a bar and then just color in the blocks as you move along from 0 to 100% done. So visually that kind of shows you there's different levels of doneness of this process. Other things that I've added, and this section is optional, but I think it's helpful, is to identify what resources you need, if there's any seasonal or cultural time considerations to keep in mind, and also all the staff and people time required. So if you're as detailed as my organization is at UNM, where we do everything by FTE, then that might be something you list here. It's just whatever makes sense for you and is most helpful. Because by all means, this action plan should be actually helpful for you, and it should communicate really quickly and effectively your whole vision of what you're going to be doing. So don't add anything that doesn't really help you in the long run. So to summarize and pull all of this together, I just have a couple of tips for you, and some advice that I've collected along the way. Your action plan should be first and foremost informed by your community. The work that you're doing is for the benefit of your community, and so your community should have input on what it is that you do. And you're doing that a couple of ways. You're doing that through your assessment. You're also doing that by inviting them to come to the action planning meeting. You're doing that by communicating your action plan back to the community. There's so many different ways that you can approach this. But really, the bottom line of this is that the collaboration is what's key to this. It can really feel isolating, I think, when it feels like you're the only person doing this kind of work. It gets really frustrating. There are times when you really feel like it's not moving as fast as you want it to. Well, if that's the case, take it back to your community, and you might be surprised by what you hear in return. Second, your action plan should be concise. It doesn't need to be any more than 2 pages. Really focus on your goals, your objectives, and outlining your activities for right now. That would be a good start for September, your first meeting there with the ladies at the Native Strong program. It should also be clear. It should be apparent who's going to do what and by when. Again, you don't have to identify individual people, but you can identify organizations or partners or programs. And then your deadline, you can refine it as you move along. And finally, this is really just my piece of this, because of course, I'm Navajo, and I know what it feels like when other people are planning for you. I know what it feels like when you are not a part of that organization, or when people highlight where you're going wrong instead of where you do things well. And so this is really all what we should all be striving for as Indigenous planners and Indigenous public health professionals, is really focusing on the assets of our communities, because our communities are incredible places to live. We have some really great people in our communities. There's a lot of amazing stories that are waiting to be told. So we should highlight those in every step of this process. It should be a part of our action plans, and it should be a part of our team. So where is it that we are well situated to do this work, and what are our strengths? What are the things that set us up to be in a good place to address sugar-sweetened beverage consumption in our community? And finally, your action plan should be outcome-oriented, always thinking about what it is that we're going toward, rather than getting stuck in the day-to-day activities. What is it that those day-to-day activities really lead to? What's the big picture? And so keeping those in mind will really help revive you as you move along. It will help you address those blocks that happen along the way. And it'll also help create some stability in your program. So these are some of the tips that I always work by. So finally, I just want to summarize this by saying that your action plan really has a lot of flexibility. It should be responsive to you and your team and your community. That's who the goal is. So use a process and a plan that makes sense for you. So all of the things that I've presented in this presentation are meant to just inspire you, to be tools if you want them, and they're there for you. If you want additional focused support on any part of this presentation, by all means, please feel free to reach out to me. My contact information is on the slide. The ladies at NB3 know how to get a hold of me. I'm here in Albuquerque. If you ever find yourself in this area, I'm happy to meet with you if you want some feedback on anything. Otherwise, I just want to say thank you again for your time and your attention, and to wish you the best of luck as you move forward with your programs. So with that, do we have any questions?
Yeah, Nathania, I'm going to go ahead and start unmuting everyone. So if you have the dogs or the kitties, if you're welcome to remute yourselves, but I'm going to go ahead and unmute everyone so that you do have the opportunity to just talk. And also, for those of you that are not able to, you can also type your questions into the chat box. So just give me 1 sec. I'm going to start unmuting people.
Okay.
Okay, so everyone is now unmuted. Feel free to ask any questions or thoughts, or even things that you're starting to, maybe just things that are going through your mind as you've listened to all of the information that's been presented. Well, I guess I had a couple of takeaways on this, and the first is that, this is not done in the back room. As Nathania mentioned, it is a collaborative process, so I do want to re-emphasize that in terms of developing and creating the action plan. And the other piece that we talk about here at Native Strong, because we're kind of we're like, oh, what are these action plans going to look like? We're not sure yet. But what we're hoping they are not is just a plan of different activities, right? We're really encouraging you, and I will send out the presentation as well as the articles that Nathania mentioned, but that whole table about PSE change, we are hoping the action plan is not just a list of a variety of activities, but that you're really thinking about how your actions are going to reflect long-term change. So we know that some of you are not yet, you might not be doing a policy. It's not going to be an immediate policy change, but you are working towards something. It doesn't have to be the policy, but some sort of long-term systemic change. And you may not get there in a year and a half, and we don't necessarily expect that for some of those bigger goals, but that you have started to plant the seeds and are working towards that sort of type of goal.
Yes, this is Perdita at Santa Ana.
Hi, Perdita.
I just, that word policy is such a heavy word, and so I really appreciate Michelle Steeman at Albuquerque Area Southwest Tribal Epicenter. She tends to use the word practice in place of policy, because things like, gosh, what policy can we have in place by March 2019? And it could happen, but I think about changing practice is it always feels so much more feasible and friendly in terms.
Thanks, Perdita. That's a great point. And we're not necessarily, I think policy is just the easier word to say, but we're definitely not necessarily asking that a policy like a tribal resolution be put in place. But yes, definitely in terms of practice, looking at the environment that you particularly work in, how can you influence it in the long term to make long-term change so that our kids are drinking less sugary drinks and drinking more water and or breastfeeding.
Mhm. Oh, and Michelle, I also just wanted to add too that policy doesn't just happen at the governmental level too. It happens at the organizational and institutional level. So it could be at a school or it could even be within your own program too. So it happens on smaller scales too. So it really does lend itself well to what Perdita was saying about it being practice.
Any other thoughts? Maybe good things, bad things that are kind of going through your mind as you're going through all of this? I know some of you on the check-in calls felt like you were in a good place, but that was kind of before we started, before you started going through the actual process of creating and developing the action plan. Um, any other questions or clarifications you might have on what that could look like? Well, it sounds like everyone is in a good place so far. So I just want to thank Nathania for all of her hard work. She created this presentation from scratch specifically for our Water First grantees. So I really appreciate the time that she's taken to think through all of the elements of the cohort to make it most useful and practical for our grantees. And then, of course, Water First cohort teams, I would just like to encourage you, since I know most of you are just one representative per team, I would really like to encourage you to create some time, carve out some time with your team to go back through the action planning slides and really start to think through how you're going to do this process if you haven't started it already. And then if you have any questions as you're moving forward before September 6th, please feel free to reach out to us at any time with any questions that you may have. So
Yeah, this
hope
is
you all have. Oh, go ahead, Perdita.
All of us showing up out there with a bunch of Post-it notes. That'll be interesting how to transport those.
Yes, absolutely. I always get excited about the Post-it notes, but that's just me. Well, we hope you all have a wonderful weekend, a happy and healthy weekend, and we look forward to seeing all of you in Flagstaff. And thanks again, Nathania, for all your help.
You're welcome.
Take care.
Thanks.